Good afternoon and welcome to the COVID-19 update press conference. We thank you for joining us. Here is the latest update on COVID-19 in the Bahamas. The total number of confirmed cases remains at 92. Of that number, 72 are in Nassau, in New Providence, 8 in Grand Bahama, 11 in Bimini, and 1 in Cat Key. There are no new cases reported today. The number of recovered cases has increased by 5, bringing the total to 31. Active cases are at 50. Deaths remain at 11. Hospitalized cases remain at 8. We're pleased to tell you that a total of 1,539 tests have been completed. When one reviews the slide breakdown by island, one sees the representation of the majority of cases in New Providence. When we compare the comparisons of cases in islands, slide 2, you see that in New Providence, there's a cluster and sporadic cases. In Grand Bahama, there is sporadic transmission, but in Bimini, there are cluster transmissions. At our last press conference, we pledged to inform you of our findings in Bimini. The island has been deemed a hotspot. For the period 29th of April to the 2nd of May 2020, members of the surveillance team traveled to Bimini with health education support. This was done in order to meet with the medical personnel, assist with identifying contacts of confirmed cases, to visit the government quarantine facility, enforce infection prevention and control measures and strategies, conduct testing. They also held a town hall meeting via Zoom on the 1st of May, and a total of 190 households participated. We report that on that visit, a total of 37 people were swabbed for COVID-19 and 3 tested positive. To date, a total of 78 people on Bimini have been tested and 11 have been positive. We can show you in a slide the comparison of the various cases. We have heard the recommendation from you and the public to quarantine Bimini for 2 weeks to slow the spread of COVID-19. I wish to inform you that this has been given serious consideration at this time. When we look at the next slide, the daily number of cases, this is the epidemiological profile. We continue to make progress. The daily number of confirmed cases has not increased above 5. We have had multiple periods with no new confirmed cases. Specifically, in Grand Bahama, we recorded a 2-week period when there were no confirmed new cases. When we look at the next slide, the daily and cumulative number of cases by deaths, you see the flattening of the curve. And as indicators reveal, this is occurring over the past few weeks. And we wish to say this is in compliance, the compliance of Bahamians to the lockdowns and curfews. The Ministry of Health, could we show the other slides, please? However, when we look at the Bimini projection, I shared with you earlier when we looked at the all Bahamas projection, there was an exponential increase in cases. What we are observing in Bimini is that event. Next slide, please. When we look at Grand Bahama, we see that the flattening of the curve. We just recently, after 2 weeks of no new cases, we reported 1 new case in Grand Bahama. Can we see the next slide, please? We're often asked, when will the lockdown or the restrictions go away? When would we return to normal? Our best fit of the hill curve is what we're seeing here. If you look at the number of cases on the y-axis and the dates, if we go out to the 31st of May, the data we have today, the 5th of May, has a very nice fit. And you see the number of cases around 100. If we have an increase in number of cases, we'll follow the green line. And we certainly would be very concerned with that number of cases. The Ministry of Health remains concerned about the number of frontline healthcare workers who have contracted COVID-19. Exposures to COVID-19 have been experienced in a number of our healthcare locations, including Princess Margaret Hospital and Doctors Hospital, notwithstanding known social exposures. We will show you in the next slide the breakdown of the healthcare workers. To date, we've recorded 22 healthcare workers, 5 physicians, 1 physiotherapist, 2 trained clinical nurses, 1 domestic staff, 7 registered nurses, 6 patient care assistants and technicians. If you would show the next slide, we looked at this. This accounts for 23.9% of the total cases in the Bahamas. This slide shows you with the arrow where we rank by country among the Americas. Indeed, a very high percentage. Consequently, plans are in process to closely investigate the reasons why so many healthcare workers have been affected by COVID-19 in the Bahamas. This investigation would support the identification of the most appropriate infection prevention and control measures to be strengthened to better protect our healthcare workers. The investigation will also identify vulnerabilities and characteristics of the exposure risk factors. We propose to conduct a case-controlled study which would characterize the risk and effectiveness of what is in existence at this time for prevention and control. We will participate with the Pan American Health Organization with its investigation, and the information will inform the international scientific community recommendations on prevention and management of COVID-19 in healthcare workers. The Ministry of Health is concerned about healthcare workers who provide additional services outside of the major health facilities. Since the 21st of April, when the emergency powers orders related to the provision of home care services was signed to give effect to, this was done to give effect to improved medical therapeutic, and other patient care in homes and residential facilities. More than 130 home care providers have contacted and submitted documents to the Office of the Chief Medical Officer in the Ministry of Health. All persons provided details on their training, qualification, and practice. A number of them have completed infection control protocol training provided by the Ministry of Health in partnership with the Early Access Training Center prior to providing any further care. Letters authorizing these persons to continue providing home care services are issued by the Ministry of Health. We have been asked to provide specific health indicators for the phased approach to loosen measures and return to a sense of normalcy. It's a daily question. A careful risk assessment has been completed and a staged approach designed to balance the benefits and potential harm of adjusting these measures. As the Prime Minister outlined in his most recent national address, the following criteria are considered by the health team when recommendations are made for moving from one phase to the other and relaxations of existing restrictions. 1, the number of new cases over specified time intervals, together with the model predictions you have seen. The capacity of the health system to respond should we have increased number of cases. The number and dispersion of contacts of confirmed cases, not only in Nassau, but throughout the archipelago. We must also identify vulnerabilities in congregate facilities. For example, prisons, churches, funerals, social gatherings, and long-stay facilities. We must also evaluate compliance with existing restrictions. Careful considerations have been made to ensure that we do not trigger a resurgence of COVID-19 cases and jeopardize the health of the residents of the Bahamas. We continue to monitor the institutional capacity to respond should we have an increased number of acutely ill cases. We have been successful in managing the COVID-19 hospital requirements through the hard-working teams at the Princess Margaret Hospital, Doctors Hospital West, and the South Beach Center. You have heard that we have increased our testing capacity considerably at our National Reference Lab. And this is in no small measure attributable to the hard work, keen focus, and determination of Drs. Martin and Edwards. The testing capacity and various aspects of our overall response have been greatly aided by generous partners and donors. The Pan American Health Organization has been a faithful partner to the Ministry of Health. Under the current leadership of our representative, Dr. Esther de Govell, the Bahamas has received invaluable aid. But before I invite Dr. de Govell to speak about this significant partnership. I would like again to thank Bahamians for their compliance to the public health advice and following the emergency orders. More than 264,000 people have died from the virus worldwide. Together, we must stay disciplined. We must keep following the rules. And if we do, we will keep the number of cases to a minimum and be able to open up more of our economy sooner. Thank you. I now invite Dr. de Goville.
Thank you, Dr. Dalrages, and good afternoon to everyone. The Pan American Health Organization and the World Health Organization are supporting the Ministry of Health in multiple ways for the COVID-19 response. PAHO's staff are embedded in the Emergency Operating Center, providing expertise in virology, epidemiology, health systems planning, and communicable diseases. Outside of the EOC, PAHO's staff are supporting preparation of communication materials for the general public and for mental health advice. This is accomplished through providing access to WHO and PAHO infographics and standards and guidelines. We have also donated laboratory test supplies sufficient to test close to 8,000 persons and personal protective equipment sufficient for enhancing infection prevention and control measures in the clinical care of up to 100 patients. We continue to provide access to online training courses and technical meetings, which are attended by healthcare workers to increase their knowledge in areas relevant to the outbreak response. Areas such as infection prevention and control, clinical management, surveillance, public health measures, such as social distancing and data management. We continue to build on our past technical cooperation program with the Bahamas, in which we have repaired laboratory equipment, installed furniture, and trained personnel at the National Reference Lab that continues to provide testing for COVID-19, as well as influenza viruses and other categories of viruses which are not of immediate concern. In collaboration with the United States Agency for International Development, Office for Disaster Assistance, following Hurricane Dorian, donations were made of temporary modular units to house healthcare workers and different healthcare services in Grand Bahama, Abaco, and New Providence. We were fortunate to be able to repurpose one of those modular units at the Princess Margaret Hospital, where it is being used for triage and temporary inpatient care of patients. PAHO is collaborating with the Ministry of Health and the Public Hospitals Authority on investigating COVID-19 infections in healthcare workers in order to identify the risk factors that may have led to infection and aid in the planning of mitigation measures so that we can minimize risks to healthcare workers and to patients. The Director General of the World Health Organization and the Director of the Pan American Health Organization hold frequent meetings with the heads of state of member countries and the ministers of health. These are held with a frequency of 1 to 2 weeks to keep them updated on the global pandemic and emerging policy issues. PAHO and WHO remain committed to continuing our support to the national authorities in the COVID-19 outbreaks and in planning the appropriate mitigation measures. We continue with our broader technical cooperation program, and we look forward to the end of this outbreak so that we can continue to strengthen the health services in multiple ways as we have done over the last 40 years in this country. Thank you.
Thank you very much, Dr. Esther de Gorville. We'd now like to invite questions, and we begin with Shamako Lightburn, please.
So my first question, there's been a harped on study in the international science community showing that blood thinners show promise. Data is coming mainly from a New York hospital systems observational study of about 2,733 persons in and out of the ICU. Is the ministry currently working with any data to suggest that and try to confirm that hypothesis?
Thank you. Do you want to? We could not hear your question. Do you mind repeating it, please?
Sure, no problem at all. There's been a famous study in the international science community showing that blood thinners show promise for boosting survival chances for even the sickest person who has COVID-19. That comes from a New York hospital observational study where they looked at 2,733 persons in and out of the ICU. Is the ministry working with any data to suggest that that's a lead worth following, or if that's an hypothesis they would like to prove?
I'd like to invite Dr. Forbes to comment on that, please.
Good afternoon. Thank you very much for your question. So we are following the scientific literature on a daily basis, and we are aware that there have been reports of patients with COVID-19 that
Just
have
unmuted. Okay, so I unmuted.
that have thrombotic manifestations. That means they are having clots, and we're seeing small clots in the lungs after the postmortem samples of those patients from a number of places, including Italy. Certainly, it is something that we are following. In our own cohort, we have had at least one patient who's had a clot in a large vessel, and so those patients will get anticoagulation. We are watching that and the other scientific information as it unfolds. So thank you very much. That's a good question.
Do you have another question, Shamako?
Yes. So my second question, there have been reports from Bahamian business owners that they've sought clearance to retrieve personal protective equipment to mitigate the spread of COVID-19, a lot of which are currently at Bahamas Customs, so they claim. The sentiment is that foreign business owners are getting expedited service or more accessibility. Can you clarify for us if there is one exact procedure for everyone that guarantees fairness?
I'm sorry, I cannot. If Mary Walker is here, she can answer that. But to our knowledge, there's not been any inequity or discrimination against persons who are at the customs level. Next question, please. Altanese Munnings.
Good afternoon, ma'am. How are you doing today? My first question is regarding those Bahamians who will be returning home tomorrow from Florida. How will the Ministry of Health determine which individual goes under home isolation and which individual will be placed in a government-run quarantine facility?
Good. Thank you very much. We've been working on that, and Dr. Brennan will answer that for you.
Good day. So for the repatriation exercise for tomorrow that is planned for the Bahamians who are returning from the South Florida area, we have been working with the Ministry of Foreign Affairs, the Royal Bahamas Defense Force, Ministry of National Security, the NEMA, the Office of the Prime Minister. So it truly is an all-of-government approach. As we are doing it, we have realized that the way to make sure that we're protecting our populace is to ensure that we put in place parameters for people who are going to be able to come into the country and be able to come into either a government quarantine facility or to be able to go home. So at the beginning of the exercise, we will be basically we'll be doing a risk analysis for everyone. We'll be doing an evaluation of those who request to have the ability to go into home isolation or home quarantine, and when we complete the analysis, if it is deemed that the facility or home situation that they are wanting to go back into has been evaluated by one of our government agencies, whether the Ministry of Health, Social Services, if their facility, their home, is determined to be suitable for them to be able to go into and safely be able to home quarantine, then we will allow them to sign an agreement that says, yes, they will go in, they will follow those rules, they will continue to be monitored by the Ministry of Health, but then we could be assured that there won't be any issues with ongoing risk to the community by introducing them into the wider Bahamian populace.
Thank you, Dr. Brandon. My second question is in reference to testing of the most vulnerable groups. Health officials had stated that they were testing several vulnerable groups like elderly in the churches. How far is the Ministry of Health with that testing, say specifically for individuals in prisons, etc.?
Thank you very much. We certainly had intended to complete this a week ago, but we had to reprioritize and look at the capacity of the lab to do the tests, the PCR testing. And given the supplies that we had a week ago, we had to reprioritize the healthcare workers in Princess Margaret Hospital and the dialysis patients. So we've had to reprioritize, and this coming week, I'm pleased to inform you that we intend to revert to the listing that we had for the priorities prisons and healthcare workers who provide care in long-stay facilities and private homes. So the list next week will begin with those groups. Next question, please. Ralston Jones.
Good afternoon, Dr. Dalregis. With the number of quarantined people, which hopefully you can speak to the specific number, how has adherence been, compliance been with the restrictions there? And is there a need for greater monitoring via the remote wristbands you'd mentioned recently?
Yes, good question. There were fewer than 250 persons who are now in quarantine. Many have graduated out of quarantine. 12 of that number we have not been able to find. That's the specific numbers. With regard to the electronic monitoring, we are in the process of signing a contract for the use of an app for verification of quarantine, which draws a perimeter around the quarantine site and then sends an alarm should there be violation of that perimetry. We are coordinating this with surveillance units, Royal Bahamas Defense Force, and law enforcement agencies. And we hope to do the same in all islands, not only in New Providence.
I do have a couple more questions there, but just for another matter, if I can ask, the Pan American Health Organization has said the country should take a cautious approach to reopening countries and suggested a 2 to 3 week gap between each phase or stage of opening. We've seen 9 new cases since Monday when the Bahamas moved to phase 1B. What does the data on cases say about the increased commercial activity, and how is the monitoring going?
If you would just reflect on the slide that showed the distribution by island, you saw that some was sporadic in Grand Bahama when they had 2 weeks of no new cases. But the others, you saw clusters. Yeah, you can go back, clusters of cases. And we interpret the data differently if you have a cluster versus sporadic community spread. So when you look at the New Providence distribution, we have a combination of both. And so indeed, we are in full agreement that there needs to be at least 2 weeks of monitoring of new cases, particularly those related to community spread and not so much with cluster of cases. Oh, you've had 2 questions. Jerome Sawyer, our News.
Good afternoon, Dr. Dalregis. My first question follows up on the question that was just asked relative to the new cases and which you would have referred to in your remarks as the flattening of the curve due to the compliance of the Bahamian people. Are you able to say at what point would the data might suggest to you or officials that we may have to revert to one of the previous stages? And I guess what I'm asking has to do a bit with for Grand Bahama, for instance. We would have seen no new cases and then a sporadic case after 2 weeks. At any point, what would be the indicators that we may have to move back to some previous requirements or some previous lockdown scenarios should the cases increase or spike again?
Excellent question, and we're struggling with this to determine those indicators. But what I would say to you, we're not only monitoring the new cases, we're looking at the flow-through accident and emergency. We examine data that comes from the call center, the 511. We evaluate the hospitalization stay when symptoms begin and when they're discharged. So it informs the capacity of the healthcare facility to accommodate increase in cases. And we have good data that show most recently of the 9 cases, as you see the flattening, there have been no increase in deaths. When we look at the hospital admissions of the new cases, we're seeing a clear decrease in the number of requirements for ICU care. And we're looking at the period of recovery. So all of these variables are considered, but we have not, as a health team, proposed those indicators that would cause us to revert to increased restrictions or change in the restrictions at this time, but we are monitoring it. And we're prepared to make that recommendation if we think it's warranted.
Okay, thank you. My second question has to do with your indication of the concern for the number of healthcare workers who have tested positive, the numbers that you revealed to us. During the last press conference, you would have confirmed that the rapid antibody test would have produced some false negatives. I'm just curious as to whether there is any indication that those false negatives or that situation would have resulted possibly in the high instances of healthcare workers. Has there been any correlation between those false negatives as well as even the numbers in the community spread?
Doctors is the only institution that's using the rapid test. And we've invited Dr. Sheena Colley, Antonio Colley here, and we'd invite her to respond to that question.
Good afternoon, everyone. So at Doctors Hospital, as you know, we are a healthcare facility, a private healthcare facility on the island that has come alongside the government to respond to the pandemic of COVID-19. We have had in our institution both patients as well as associates who have been infected with COVID-19, and we have done what I would say is an excellent job of implementing IPC programs as well as other mitigation procedures in order to limit those exposures. And I'm happy to say that we've had no new cases of PCR positive associates in particular in the last 3 to 4 weeks. We have, early on in our experience with COVID-19, we had instituted the use of the rapid antibody testing. And the way we have been using that test in our institution is not for the diagnosis of COVID-19, because as we know, and definitely the science has informed, that antibody test is not appropriate for the diagnosis of COVID-19. And we have stuck to the gold standard of the PCR, rapid PCR test, the RT-PCR test, as the way to diagnose COVID-19. We have been screening our healthcare workers for the presence of antibodies for for our own institutional protocols, as well as for future endeavors, looking at the presence of antibodies in our healthcare workers who have been positive symptoms, as well as positive contacts of patients or otherwise with COVID-19 as well too. We have done correlation studies, just very limited and very brief, and we've not seen any correlation between false negative cases along with positive PCR cases. There was also not a high correlation with positive antibody testing and positive PCR testing. So we have not been using this, as I say and continue to say, for diagnostic purposes. Like I said, we've stuck to the gold standard. And once again, those screening exercises will and have been limited right now to staff members, and as well as some physicians have also asked to have their patients tested as well too with our rapid test. And with the limitation of knowing that this does not say that the patient is positive for COVID. So I hope that answers your question.
Tyler Simonet.
Yes, good afternoon. My first question is, as of right now, we know that many countries are racing to develop a vaccine for COVID-19. And if, or rather when this vaccine is developed, can you please explain if you are prepared a plan of action for when it is developed, such as testing its safety and distribution of the vaccine?
Okay, I'll ask Dr. DeGorville.
As you have stated, many countries are collaborating with the World Health Organization in the race to develop a vaccine. And you would have seen in the mass media that even though this race is very serious and very urgent, that the prospect of having a vaccine in the short term is not realistic. Developing a vaccine requires us first to complete at least 4 stages of testing. The first is to actually prove that the vaccine can be used safely. The second is to prove that it actually elicits an immune response. The third is to trial it within a large enough group of people that you will determine whether there are any adverse effects to the vaccination. And the fourth stage is mass scale-up of production and distribution to the population. And all of this, in the best of times, can take up to 18 months. Once a vaccine is developed at a large enough scale, decisions have to be made about equity in the distribution of the vaccine to all countries of the world. And as you would realize, this outbreak has affected all countries of the world, so that we all have susceptible populations that are in need of vaccination to prevent infection. Part of the work that needs to be done for the introduction of vaccine is to determine the prevalence of susceptible persons in the population. So at that stage, tests such as the ones that were just described, serological testing, takes on a very important dimension in order to determine what proportion of the population remains susceptible and can benefit from the vaccine. So this preparation of a plan for introduction of vaccine at some stage needs to be part of our preparatory activities during this phase of the outbreak, even as we respond to bring the outbreak under control. And most countries of the world are considering those preparations as part of their response activities as well.
Do you have a second question, Tyler?
Yes, please. And still piggybacking off of the vaccine question, could you please explain how important herd immunity would be for that vaccine, and what will happen if a majority of people refuse to take this new vaccine? Because as you know, many Bahamians don't have their measles shots or have taken their flu shots, so what will be done then?
Well, I would, no, come Dr. DeGorval. I would start as she comes. Certainly, you know, I think we've had a very good experience with the development of the vaccine for influenza. And certainly we make it available every year to ensure that we protect the population. But you are correct. We have persons who refuse to take the vaccine. So I'll let Dr. DeGorval go a little further with respect to what that herd immunity will do.
When we talk about herd immunity really implies that you have sufficient persons in the population who have experienced infection and developed protective antibodies such that if they are re-exposed to the virus, they would not become infected. And that herd immunity is one that is normally acquired through natural infection. Herd immunity can also be acquired through vaccination. So at this stage in the Bahamas, but for the 92 confirmed cases and possibly a few of their contacts who may have been exposed, the vast majority of Bahamians remain susceptible to COVID-19. And I want that to sink in. The vast majority of Bahamians remain susceptible to COVID-19. Those of you who have embraced the reopening of the alcohol shops, and I have seen myself with my own 4 eyes, people having a little boot alcohol party in a car park yesterday, you remain susceptible to COVID-19. And the risk that you're taking to your own health, the health of your family, the health of the wider community is a huge one, and one that we would prefer to avoid. So in terms of the herd immunity, these seroprevalence studies that I mentioned before will give us an idea of how many people in the population have actually acquired antibodies through natural infection prior to the introduction of the vaccine.
Thank you. Shashina Roll.
Good evening.
Yes, this is Grand Bahama.
Yes, good evening. We understand that you're concerned for healthcare workers. The question is, are any of these new cases, new reported cases, frontline or medical workers? And if they are infected or in quarantine, are they tested before going back to work to avoid the spread of the virus upon their return?
Sorry, so are you speaking specifically to Grand Bahama or generally?
Yes, for Grand Bahama, I'm sorry.
Okay, I think we have Dr. Bartlett from Grand Bahama on the line. No?
Yes, we do.
Oh, okay.
Good evening. For healthcare workers that have tested positive, okay. The answer to the question, the direct answer to the question is that they are retested after they finish the The answer to the question, the direct answer to the question is that they are retested after.
Okay. Continue, or should we move on?
Come back to work.
Dr. Bartlett, would you turn down the audio, please? Okay, try again.
We did that.
Okay.
Okay, try again. We did that. Okay.
Shashina, would you repeat the question so he can respond,
Was there another
please?
question?
We did not get your answer. Would you repeat your answer, please?
Sure. Dr.
Okay, we're having some
The answer
difficulty.
to the question as to whether the
Do you
healthcare
need me
workers
to
should test
repeat? I think
positive
there's a
for
delay.
COVID-19,
But the
as to whether
question
the
is,
test would be repeated before they return back to work, the answer is yes, that it is repeated.
Okay, I think I would repeat what Dr. Bartlett said. He is confirming that yes, those healthcare workers will be retested prior to returning to work. Do you have a second question?
yeah, also a part of that question was, are you able to say if these last cases, if any of them are from the medical sector?
Is Dr. Bartlett still on?
Yeah, the last case that we have. Still on? Yes, I am. Yeah, the last case that we have.
I think there's a delay.
To answer the question again, the last case that we have tested positive in Grand Bahama is a healthcare worker. The healthcare worker would have tested positive the day before yesterday. The Grand Bahama Health Services surveillance team is now in the process of doing contact tracing, and we would have looked at and evaluated all of the persons within the healthcare arena who would have been involved with that patient. And also we looked at the community, level of community involvement, and we are in the process of doing contact tracing with those persons who she may have been in contact with within the community.
Okay, your second question? Shashina? Okay. So we're moving on. Oh, Kyle walking. Kyle?
Hi.
Oh, this is our news?
Yeah, that's me.
Okay, go ahead.
We can't help but notice the absence of the temporary Minister of Health. Any idea where he may be, and how will the absence of Dr. Dwayne Sands affect what happens within that ministry?
Well, we would have been advised that we do have a temporary minister, which is the Honorable Prime Minister. I am not in a position to say where he is, but certainly we did not have a delay in having a minister assigned to the Ministry of Health. And we are continuing to move forward with our response. Do you have a next question?
Sure. Dr. Del Regis mentioned that contact was lost with 12 people who are supposed to be in quarantine. Has contact been made with law enforcement? I mean, what are the plans to avoid losing people who are supposed to be in quarantine going forward?
Well, certainly we have, we get addresses, we get contact numbers for all of our contacts. But I would think you would recognize that at times those addresses may not be exact, those phone contacts may not be listed, and I think you would have also heard Dr. Del Regis speak to us moving forward with acquiring software that will assist us in our contact tracing efforts. We would have we have like under 300 persons in quarantine now, and we have over, I think, 1,000 or so who we would have had in contact in quarantine, and 12 of that number is not so bad, but we will be enhancing our capacities to ensure that we are doing, putting in place a stronger measure to be able to track our quarantine persons. And that software, we anticipate, will also be linked to law enforcement officers. So Matthew Moxie.
I was just going to respond.
Oh, you wanted to?
That's okay.
Okay. Go ahead.
Hi, yeah, so the 6 Americans that were essentially given admittance to enter the Bahamas last week, they would have came in exchange for test swab kits. Do we actually have those swabs in our possession, and are we using them?
To my understanding, we have over 5,000 swabs in our possession currently. I would anticipate that that includes the swabs that were brought in. But I know that we have, over 5,000 swabs in our possession right now.
But of those 5,000, are you able to confirm if a portion of those 5,000 are a part of the ones the Americans were said to have donated?
Yes, we can confirm that they are included in that 5,000.
Okay, thank you. And also my second question would be, what are the concerns of the task force in relation to the easing of restrictions? Do you have any concerns that these will essentially cause cases to skyrocket in some cases? Essentially, my question is, what is the concern of the health task force as the Prime Minister is easing restrictions of the Bahamas?
Well, our concerns relate to the potential for what you would have alluded to, an increasing amount of cases to the point where our healthcare system is challenged. And also, we would need to relax the restrictions in such a way to ensure that we ideally do not have to move in a position where we need to now say, okay, we have relaxed restrictions, our cases are escalating, our healthcare system is overwhelmed, and now we need to make a recommendation to move back. We have to use a measured approach to moving forward with the relaxations, monitor the cases, monitor what is happening, and then we want to, when we begin to move forward, to continue to move forward. So our concern would be exactly that our cases are increasing in, that would be New Providence, any of our islands. We want to be able to restart our economic engine and continue to have it move forward, not to restart and then have to stop again. So we will be monitoring the indicators to determine how we are progressing in that direction. Ava, oh, not Ava. Okay, Rashad Roll.
Good day. The redesigned dashboard shows that we are averaging about 36 tests per day. And I've seen information that countries need to have an average daily testing goal in order to say whether they can safely reopen and stay open. The United Kingdom said their goal is 100,000. In Florida, I've seen a figure of 16,000. Is 36 per day adequate? And have you all determined what our daily target of tests completed should be for us to be comfortable about the decisions we make relaxing restrictions?
Okay, Dr. Dalregis, we'll take that question.
Thank you very much. Rashad Roll, you're aware of our numbers compared to those territories that you just described. We are the 1539 tests to date certainly gives us comfort. We've also interacted with the lab, and they are able to conduct 100 tests on a daily basis if they run for 24 hours. So I think we are in a good place in terms of our capacity to respond. And should there be more cases, we are in a good position at this time, but we continually monitor the situation. Do you have a second question?
Yeah, it was reported that some student nurses being deemed registered nurses during the pandemic. And I wanted to know, is that happening because there's a shortage of nurses to help manage the crisis, or is there some other reason?
These are graduate nurses, and there is a period before they are licensed by the Nursing Council. It is often taken too long, but we're certainly making every effort to shorten that period of time from graduation and compliance with the Nursing Council. So we're doing a better job. Karen Bain. No, Ava, sorry. Eyewitness.
Hi, good afternoon, Dr. Dal Regis. Just if we could cycle back to those 12 that we've not been able to locate, can we confirm whether or not they had been tested and were at home, and if they had been planned to be retested? And also, is there any directive on how we're going to be locating them? Because obviously they're an ongoing threat now being out in the community.
They have passed the 14-day quarantine period. We are unable to find them to find out what their status are, and to test them. But I can assure you that every effort is being made to contact them, and we'll continue to do so. We just hope that they are still around, or they have not used fictitious names.
Okay, and so just if we could speak to the recent shift or transition to a temporary health minister. Dr. Sands' resignation was sort of predicated on the entry of 6 Americans. However, we would have learned that last week there was at least one other person that was allowed to enter the country. Is there any concerns by the EOC on the number of people that have been allowed to come in? Can you tell us at what point have persons been, was the decision given for people to be allowed to come back into the country? Can you share that?
Unfortunately, I don't have any information on those coming back into the country, but we know as a health team that we are not recommending open borders. Karen Bain. Good day.
Good evening. My question is in regards to Grand Bahama. We were doing remarkably well. However, we have one new case. Can Dr. Bartlett speak to the number of persons as far as a breakdown on patients that are self-isolating, who are being hospitalized, and you mentioned contact tracing?
I'm sure he can. Dr. Bartlett, please. There is a delay. Just be patient. Dr. Bartlett.
Thank you.
At present, we have 43 persons in quarantine. All of these persons basically have resulted from the contact tracing that we would have had from our last positive case. The one person that we have hospitalized is being worked up. We would have had testing for COVID-19. They're all in stable condition. The last cases, or the first cases that we would have had at the beginning of the exercise, all of them have been recovered. We have no other issues about any type of recurrence of symptoms, and everybody else that we have now, inclusive of our last case, are stable at this point in time and without symptoms.
Great.
Do you have another question?
Workers, I've noticed that a lot of nurses going out in the community are not properly dressed as far as having a shield mask, having garments over their scrubs. Is there a kit or garment package that they're supposed to be dressed in while they're dealing with the elderly and persons who are at home?
Dr. Bartlett?
The level of personal protective equipment that a healthcare worker uses and utilizes is dependent on the level of interaction. The level of personal protective equipment that so what you find now, those persons who are in direct contact with the patient, they have a different recommendation for those persons who may be in casual contact. Healthcare workers who are dealing directly with patient care, the recommendations based on the procedures they're doing for a bare minimum means that they should be wearing what we call an N95, which is a medical grade mask, gloves, and a gown. If you're doing any other type of procedures that may be invasive, then the level of protection goes to include a hood, a face mask, and gloves. For those persons routinely who are in the healthcare arena who are doing non or procedures or activities that does not involve direct patient encounters, then the bare minimum they should be wearing is a mask and gloves. So again, to answer your question, what you wear as it relates to personal protective equipment depends on your level of interaction with a suspected case or a positive case.
Thank you. Karen Bain. This is Karen Bain on the screen. No, that is Lededra Marsh.
Yes, good afternoon.
My apologies. Ms. Marsh.
Having had one new positive case, this is regarding Grand Bahama again, after 21 days with no new cases, when it comes to testing capacity, do we have the resources yet to perform mass testing in any island, especially those who that prove to be hotspots, with only a little over 1,500 people being tested to date?
I know you're from Grand Bahama newspaper. Do you wish Grand Bahama to respond? Because the Grand Bahama swabs, we have one reference laboratory. We receive all persons that are all swabs from all of the islands. We do not have the capacity to do mass testing. We're doing more testing than any other regional member at this time. With regard to the hotspot that you referred to, we have certainly taken an approach that we would sample the entire population and all the contacts of the cases. That we would sample the entire population. Dr. Bartlett, do you have something to add? If not, do you have a second question?
No, not at this time.
Ms. Marsh?
Yes, certainly. With the cases, the new cases still showing up in Bimini, after 7 weeks of the first case being recorded, are you satisfied that adequate testing has been carried out in such a small island? Or even concerned that asymptomatic people could be infecting those more vulnerable?
Yes, we are concerned, the answer to that, and we continue to test. And we're seriously considering a recommendation that has come forth with quarantine the island for 14 days. We're close to a decision about that, but we continue to test. Rachel Knowles.
Good afternoon, Dr. Del Regis. I know that earlier inside the press conference, the procedure or an evaluation procedure was mentioned for Bahamians who are returning home this week from abroad. Were permanent residents who have already been confirmed to have come in last week, were they subject to that same evaluation? And if not, how can that be thought of as equitable when Bahamians are they have to be tested and evaluated upon landing when, for example, I know Eyewitness News had a story about a Miss Dingman who doesn't appear to have gone through that process.
Your premise is that it is inequitable. We say to you that it's not. We have done the same procedures in terms of monitoring, in terms of assessment of the adequacy of the facility to isolate, and there is daily monitoring, and testing is being offered at the end of the quarantine period. Do you have a second question?
Yes, I know that you all have said that a quarantine facility has been identified. Can you advise which facility that is and how many people it can hold at one time?
I don't know if Dr. Brennan wishes to give you the specifics of that. The answer is yes.
Sir, good day. So the facility that we have identified at present is one that was put together, designed for the number of people we know that are coming in right now. So when it's sort of a chicken and egg situation, if we know how many people are coming in, we then find a suitable location of that size. However, if we were to find out that we needed more, there were going to be more people who were coming, we would find another facility of a larger size. So it's really just formed to fit what our function is going to be. So if there are going to be more people who are coming back to the Bahamas, and we know that we need to have a facility because they can't safely be able to quarantine at home, then we would look for other facilities around the country, as we have done in the past. Even before this big repatriation exercise, we looked for facilities that could accommodate the numbers when it was first just students who were coming home from China, then we had persons who were coming home from other locations outside of that area who were noted to be in areas where there was large community transmission going on. We identified locations at that time, so this is yet just building on that same way that we go about finding locations.
Thank you. There be no more questions. Have a good evening.